Hi everyone, today I'm here with Dr. Courtney, a PharmD, community pharmacist and pharmacy school professor. So Dr. Courtney, thank you for being part of this interview.
Thank you for asking.
Okay, so before we go into the details of pharmacy, could you, I previously thought, years ago, until maybe a couple years ago, I thought that with a PharmD, all you could really do is just work in a pharmacy, like Rite Aid or Walgreens or things like that.
Mm-hmm.
But it seems like there's a lot more opportunity in pharmacy. Could you kind of briefly explain what the pharmacy or PharmD degree is, and maybe the career opportunities that you can have with that degree?
With a PharmD, you have a lot of actual opportunities. So with the Doctor of Pharmacy, it used to be that you just needed your Bachelor of Science to be a pharmacist. Now they require you to be a Doctorate of Pharmacy. So you can be an MTM pharmacist, medication therapy management, ambulatory care, diabetes specialist, veterinarian specialist. I work in a community pharmacy. I work with an independent, and I'm also a professor here. So there's actually a lot of opportunities for pharmacists and many different types of careers.
Mm-hmm. And how is the pharmacy training like? Is it so for medical school they have the 4 years of medical training and they have residency and fellowship? Is that similar to pharmacy, or how is it set up? Actually,
it's completely the same. So usually you need your Bachelor of Science or Bachelor of Arts to get into medical school or pharmacy school. And then it's a 4-year program. First 3 years, didactic. Last year you go on rotations, and then you can either start practicing right away with your license once you pass the 2 exams here in California, or you can go to residency and fellowship, definitely.
Mm-hmm. And so you mentioned veterinary. Is there no veterinary school versus for humans there's veterinary versus MDDO.
Mm-hmm.
So for pharmacy you're able to do animals as well as humans?
So you kind of have to specialize in it. We were talking about it earlier before we started this, how sometimes those type of rotations are hard to get, but you can do residency programs in pharmacy. UC Davis has a great one. I did some volunteer work out there. There are some courses, they're kind of far and in between. I actually took one at the Florida Pharmacy School online for veterinary pharmacy because I have 4 dogs of my own and wanted to make sure, what I was giving them was safe. So it's kind of a different specialty that you can be in pharmacy.
Okay, and are there board certifications in each of these specialties?
Yes, in many of them, board certifications, you can go online. There's a regular one, there's geriatric, you name it, there's definitely some board certifications for it.
Okay, and since we're on the topic of education, what tips would you give pre-health students on getting into pharmacy school?
Really work hard, get that experience, really get into a pharmacy or do, volunteer work, show that you want to be a part of it and that you're really interested in it. Also, when you get into school, try to find a job, whether it be at a CVS, Rite Aid, Walgreens, Kaiser, somewhere just to get your foot in the door. There's so many pharmacy schools now, and they're opening more at this time, that I would definitely recommend getting that real experience.
And what about for pharmacy students to, I'm assuming the match is kind of similar to med students for residency spots. What tips would you give pharmacy students to match into a good pharmacy residency?
I don't actually know much about that. I didn't do a residency. I was actually in pharmacy for almost 20 years before I actually, 15 years before I got into pharmacy school. Mm-hmm. So I was a technician. Mm-hmm. So I really didn't, I knew exactly what I wanted to do. I wanted to be a community pharmacist, so I didn't do a residency or fellowship. So I unfortunately don't have any tips.
Okay, so if you're trying to work in a hospital, would you need a residency then?
Not necessarily. You would think, but a lot of our students have been able to get jobs in hospitals and specialties without going through a residency and fellowship. It does help, of course. It's great on your CV, but it's not necessarily that you have to have that. It's just easier.
How does a pharmacist fit in a healthcare setting at a hospital or a clinic? If you're in a drugstore, then obviously there's a section with the pharmacist is in charge of all the medications and dispensing and counseling patients and things like that. Mm-hmm. But in the hospital, it seems like maybe physicians are trained in medicine and then or medications, and then pharmacists are trained more so their expertise is in medications. So where do they kind of fit in the overall healthcare environment?
It depends on the environment. Particularly, some pharmacists actually under protocol prescribe, usually under a doctor of some sort, or the facility's protocol itself. But we're the medication specialists. I mean, that's what we go to school to mainly focus on. So we're really there to help the doctors, help the nurses, just make sure, you guys already have, in medical, your hands full with, trying to diagnose and all of those other things. A lot of them utilize us and say, what's the dose for this? This patient has kidney problems. This patient has liver problems. Yeah, you can look it up, but sometimes you have that, not all patients fit in that perfect bubble, that perfect diagnosis, and we can definitely help you tailor the medication to your patient.
And how often does it happen? Like, is it like doctors always consult with you on cases, or is it like when they're unsure about like drug interactions or things like that?
Kind of all the time. It really depends on the doctor, whether they see us as part of the healthcare team. Hopefully most doctors, that's going to be the norm soon. We are providers. We are considered providers in California. There was a law that was passed. So a lot of them do. In the community, I have doctors call me all the time and just ask me, how do I change from this medication to this medication? Or, I bring it up to them that there's a drug-drug interaction that they were not aware of, or the patient was allergic to something that they prescribed. Mm-hmm. So it actually happens a lot more than we think, but it's just us being part of the healthcare team.
And so in most environments, is it like kind of like a 1-to-1 or 1-to-2 pharmacist to physician ratio, or is it more like a counseling role where there's like one pharmacist for like a certain area?
It really depends on the facility. So a lot of times when patients discharge, we'll have a pharmacist come down from the pharmacy to talk to them all about their medications. There's not really a ratio, I would think. We are the pharmacy. It depends on how big the facility is. In a community pharmacist, we have so many doctors, for just one pharmacy. So.
Mm-hmm. Would pharmacists not really be moving on with from room to room with the physicians, as opposed to maybe like being in the pharmacy dispensing medications and all those things, and then they'd come out when they're sought for counseling?
Both. So we go on rounds. Certain pharmacists will have a schedule to go on rounds with the physicians and with the nurses and with the other healthcare providers on a daily basis, just so we can give our input too on the medications and things like that. But it could also be when they're called out, hey, we have a person discharging, and they will come up and we'll go over all the medications, see if they have any questions. Mm-hmm.
Could you walk us through a typical day in your life, maybe in the pharmacy from when you come in to when you leave?
Typical day, I would, come into the pharmacy. The pharmacist is the only one that is allowed to unlock it and open it. My techs arrive. At my pharmacy now, I do quite a few different things. So I could just be basically checking off prescriptions, utilizing, seeing if there's any drug-drug interactions between anything that they had been on before, or maybe some therapy change. Sometimes a doctor will prescribe another medication in the same class, but the patient won't know. So I'll have to make sure that the patient knows to stop one and start the other one. I do medication therapy managements a lot. I'll have appointments set up with my patients, go over all of their medications, make sure there's no interactions, make sure there's something not on there, let's say like Prilosec, that the patient should have been taken off of a long time ago when they left the hospital, and then kind of make sure that they're getting the best benefit from the medications. I always tell my patients that if you're going to take all of these medications, you might as well get the best benefit from them. So that's why we go over them one by one. Either we do it in person or on phone. I also talk to my patients who are on opioids. I furnish naloxone almost on a daily basis. I furnish hormonal contraception, nicotine replacement, and do travel health services too. So could be one or any of those besides just checking off prescriptions all day and, helping my technicians when I can, helping doctors with questions.
Mm-hmm. And what are the hours like on those days, and are they the same like 5 days a week?
For me, I actually just made a career change. So I worked at Lucky's for almost 20 years as a technician and then as a pharmacy manager. Now I'm here at the school 3 days a week, and I'm at the independent 2 days a week. So I'm there almost every Thursday, Friday from 9 to 6. Sometimes my technicians want to get some stuff done, and I can also get some stuff done. We come in a little early to kind of help business. But normally 9 to 6, yeah.
Okay, and would you say that's pretty comparable to most pharmacists?
Yeah, I think so. I have the luxury of having a lot of technicians. Mm-hmm. Now that I'm no longer at like more retail corporate place. We do only about 200 prescriptions. I have 4 techs and 2 drivers. So it's a little different than maybe what other pharmacists in maybe a corporate setting do. Just kind of have more time to be looking at those drug-drug interactions, doing all these extra services that pharmacists can do now.
So it seems like you're doing multiple things, and you have opportunities for like career change and things like that. Would you say that's similar to a lot of other people in pharmacy, or is that more specific to you? Like, are there a lot of opportunities to craft a career how you'd like and do other things besides just like being in the pharmacy like the whole time at one like a retail store?
I think so, but life is what you make of it, right? Mm-hmm. So if you want those opportunities, you need to go out and find them because they're not always going to find you. I am very involved. I was the Sacramento Valley Pharmacists Association president. Mm-hmm. I'm now the immediate past president, and I'm very involved with California Pharmacists Association and the American Pharmacists Association. So those places are where I network. Those places is where, I have we call them Pharmally, like their family, because they're my pharmacy family. So those type of places help me get those opportunities to move further in my career and kind of be able to tailor my career where I want it to go.
Mm-hmm. And how would you recommend pharmacy students, like when they graduate, to get into those new opportunities? Would it be mostly through networking, like you mentioned?
I would, yeah. Networking. Pharmacy is a very, very small world. Everybody knows everybody somewhere. You'll be amazed. I think it'd be the same when, you get done with med school. Everybody knows everybody, somebody, somehow. So definitely just form those bonds, even during school. I think school is one of the most important places. I mean, I actually graduated from California North State, and now I'm a professor here. Oh, wow. So I mean, just forming those opportunities and networking with even my professors helped me kind of further my career here because I knew I wanted to teach. So
kind of going back, what made you decide on doing pharmacy and your particular area of expertise?
That's so funny you said that. Okay, so I wanted to be a computer programmer. And I took my first DOS-based class and said, absolutely no way, this is not going to happen, and I can't sit behind a desk all day. And so I was right out of high school, I was a cashier at a Rite Aid. And they said, hey, Jennifer, tomorrow the pharmacy needs somebody to cashier. Would you mind? I was like, yeah, sure. Extra hours, absolutely no problem. I went in the next day, volunteered my time. Of course I got paid for it, but cashiered all day. And I said, this is pretty cool, And so I ended up getting my tech license and then still thought I was going to be a computer programmer for some reason. And then one day I just decided, I could help more people. Not just being a technician, I could help people further and give them more information and educate them about the medications that they're taking and how to be healthier and happier and their quality of life go up if I could just be a little bit more educated and go to school for it. So I decided to go to pharmacy school a little later than most, but I decided that I just really wanted to help people. I still volunteer my time. I still get out with the public. I'm the advisor here for the APHA CPHA student chapter, and so I help them kind of grow and do the same and hopefully give them the same opportunities that I had when my professors helped me do those types of things.
How would you say that lifestyle of a pharmacist is different from that of maybe like a physician?
I don't know, because I don't know quite what it's like to be a physician.
Do you find like the hours pretty manageable, or?
I think so. I think it's where you are practicing, though, where you're practicing pharmacy. It could be a lot of hours, a lot of OT. I kind of submerged myself in pharmacy. I love what I do. And so it's kind of like never working a day in your life type of thing. So especially when I can do this kind of stuff, especially when I get to teach and get to furnish things, and just practice at the top of my degree and at the top of my license. Really all depends on where you end up, I think, whether it's one way or the other.
And what are the average hours like for a pharmacist usually?
Usually just 8 to... Well, some pharmacists work 8 hours. At Lucky's, I worked 4 10s. And then some work 12 hours. So it really depends on your company and where you're at. Some hospital pharmacists put in a lot more time also. So it really just depends on where you're at. I know as a professor, there's always grading to do. There's always, building your curriculum. So those can take extra hours also.
So would you say that like weekly hours are about like 40 hours a week?
Yeah.
Okay. It's like a standard business hours kind of.
Yeah.
Okay.
It can be more depending on what you're doing and how much OT you're working and things like that.
So what is the most challenging aspect of being a pharmacist?
Just the part that the public doesn't know quite what we can do yet. I did an MTM for a patient the other day, and I wrote it all up and sent it to him, and he came in and thanked me so much. He's like, I didn't even know pharmacists can do that. I didn't know that you had all this information and all this great information you gave me about my health and how to take my medications, and making it easier on me. That was so cool. Thank you so much. Mm-hmm. So just, the public and even like the doctors, when I first started doing MTMs, the doctors were like, what are you doing? Like, we've never even heard of that. Mm-hmm. So they thought we were kind of stepping on their toes. So I think that's one of the most challenging things, is to get it out to the public and to the physicians that we're part of the healthcare team, and that we just have the patients, health and their quality of life, just that's what we are here for, just to better everything.
And could you explain what MTMs are?
Oh, medication therapy management.
Okay, and what does that involve exactly?
So basically, they're chosen basically by their insurance, and they have some sort of criteria. Usually they have four to six disease states, diabetes, hypertension, chronic kidney disease, things like that. And so they're chosen, and we get this kind of list where we go, we do a complete medication review. It's called a CMR. So basically we talk to the patient either comes in or we get on the phone, and we just go over the medications one by one, make sure, like if it's insulin, make sure they're using the 5-finger method, make sure, they're eating healthy, if they can exercise, if they've talked to their doctor about that, how do they take their medications, are they adherent to their medications, is there some sort of side effect that they're having, why they can't take their medications anymore, or why they're not taking them all the time, maybe they're just forgetting, and we can help them with some tools, Smartphones are great for that. The 7-day pill reminder things like that. So make sure there's no drug-drug interactions. Make sure that they're getting the best benefit from their medication.
Mm-hmm. Okay. And on the other hand, what are the most rewarding aspects of pharmacy?
I had a professor once that told me, what a shame, Jennifer, that you're going and you're going to stay in community pharmacy and you're not going to do a residency. What a waste. And I said, no way. I can still be clinical in a community pharmacy, and my favorite part is being with the patients. I love talking to them. I love educating them. I love that, they call me with questions. I used to have a guy who would call me and tell me that his A1C, as soon as he got it back from the doctor, because he was so proud, he was like, it's down to 6.5, and he's on 5 different diabetes medications and trying to, eat healthy and those types of things. So I have these patients who make it worth, that's the most rewarding part of my job, is for them to come and just living well and being healthy.
Mm-hmm. And you mentioned the public sometimes has misconceptions about maybe what you can do, or maybe even physicians do. Are there any other misconceptions besides maybe like the MTM that you noticed?
A lot of people just don't know the services that we can do now because of SB 493, the state bill that came out that made us providers. It also gave us protocols for different things. So naloxone, hormonal contraception, nicotine replacement, those are travel medications. Those are just the types of things that we can do. And what I want to do as a pharmacist, I want to do more of this, but the word, it's hard getting the word out, so it's hard getting the word out what we can do, and that come to me if you need it. I'm here to do it. So. Okay,
so then could patients come to you without seeing like a primary care physician?
Yes.
Okay.
So for any of those services, we usually do like a quick questionnaire. Let's say it's hormonal contraception. We do like a quick questionnaire. I review it, make sure that they are a candidate for it, and then kind of based on what type they want. Do they want birth control? Do they want the injection? Do they want the NuvaRing? Or do they want the patch? Depending on their preference and what I think is right for them, then I just write a prescription for it there and are able to furnish it.
Mm-hmm. And would that happen through just like walking up to a pharmacist at like a retail store?
Mm-hmm. Yeah, not all pharmacists can do it.
Yeah.
You have to do special training for it.
Mm-hmm.
I want more pharmacists to do it because I think it's so cool that we can do these things and that we're not taking advantage of it. Kind of just
Yeah.
I want more pharmacists to take advantage of the things that we can do.
How would like a normal person know whether that pharmacist at their center has it? Is it usually just like advertised or?
Yeah,
Okay.
yeah. So it's on our website. We're right now just the naloxone's on there, but yes, it would be word of mouth or that we would have to advertise in some way.
Mm-hmm. Are there certain personalities that you feel are best for being a pharmacist?
I mean, you just have to be really patient-driven. I think that pharmacists can be all types because we have closed-door pharmacies, we have hospital pharmacies, we have managed care, so basically working at an insurance or something like that where you just do formularies. So if you don't like people or don't always, a lot of people are like, well, that's not my thing. I happen to be a people person. I love talking to people. But even if you don't, there's so many other avenues in pharmacy, that you can do. If you don't want to do direct patient care, you can do it in another way.
Moving on to finances, I know we talked about employment settings a little bit, and you said there's a lot of opportunities for different kinds of employment. How well are pharmacists compensated generally? I heard retail's pretty well compensated, maybe more so than being in a hospital.
Sometimes.
And so is that true? And how well are they generally compensated?
I think that we're compensated really well. Probably somewhere between 90 to 120,000 a year. Could be more depending on your setting. Could be less depending on your setting. Usually somewhere like this, if you're into teaching and stuff like that, they usually pay a little less, unfortunately. Retail, like you said, usually pays a little bit more, and I think hospital's right in the middle, depending on your specialty too. But if you have a specialty in a residency, it could be more.
Is there that geographic skew where if you go to rural areas, it's a lot more usually?
Yep. There used to be a thing with pharmacists that there was sign-on bonuses left and right, but it's usually more in the sticks where nobody really wants to go. They usually have sign-on bonuses still and things like that in community pharmacy.
What tips would you give pharmacists to maybe maximize their income? Is there certain opportunities besides doing retail in Wisconsin or something?
Gosh, I don't know. I don't know if I can answer that question. It would be kind of person to person.
Yeah. Is there certain things that are more compensated? Like for physicians, usually procedures are more compensated than counseling. So if you're doing a specialty with more procedures like gastroenterology, you're going to be more compensated than a family medicine physician. Is that similar to pharmacy?
Possibly. It really depends on where you are. Specialty probably, and also retail. Retail does pay a lot. I mean, depending on what company you're with.
So do pharmacists work in groups? Are they usually independent, or how does it work? Or I guess most of them are affiliated with something like a pharmacy and a retail store, for example, right?
Yeah, so I mean, it depends on how the volume of the pharmacy is. So, for my pharmacy, there's only me and a technician, and then the other technicians work as clerks. But you can work at a CVS with 2 other pharmacists. There can be up to 3, 4, 5. Hospital could be even more. Depending on, IV room or if it's a specialty or who's bringing, who's verifying the orders on the EMR and things like that.
How do you stay on top of all the advances in pharmacy, or how do you recommend doing so?
Continuing education, conferences. Conferences are great. I love going to conferences because you kind of learn what's coming up, new drugs. What's the kind of future of pharmacy. Definitely CE and just being involved altogether. But new drugs are going to come out every single day. New guidelines are coming out every single day. So it's hard to stay on top of them. But I always say you might not be able to recall the information right off the top of your head, but as long as you know where to find it, that's the most important part. You can always say, I'll get back to you on that.
Okay, and so in healthcare, a lot of physicians have very high rate, or physicians have a very high rate of burnout, and I'm assuming maybe pharmacists might as well. What tips do you give pharmacists or future pharmacists to prevent burnout?
Stay involved. Love what you do. Focus on the positive and maybe not the negative. You're always going to have those customers that come in and yell at you for no reason, but you have to remember that it has nothing to do with you. It has something to do with, their disease state or how they're feeling. They're depressed. That's why they're coming to see you. You can't take it personally, and you can only tell them what you can do. I always focus on the positive. What can I do for you, not what I can't do for you. Just really stay involved in your local organizations. Like APHA, CPHA, AMCP, whatever it is you choose or whatever your specialty is, just stay involved and those people will bring you up.
Do you have any tips for establishing work-life balance or things that you do or you recommend?
So I finally, figured out what a work-life balance is, finally, after 20 years. Do the things you love still. Work will always be there when you come back. Do the best that you can and just get the most that you can done every day. But go home and try to leave it at work. Be present with your spouse, your family. If you love sports, if you love art, if you do those things still, and then just make sure that you're doing enough of both of them that you're not just, it's all work, it's, and never play.
What advances or changes in medicine do you see either in pharmacy or in the healthcare system overall in the next couple decades?
I think we're going to move more towards genetics. I think genetic testing will be better than we have now. There's a lot of drugs and a lot of medications, chemo medications, even drugs like Crestor that, based on your genetics, you may or may not be able to take, and we can tailor that a little bit more. I just think that it's just going to be more patient-centered, and we're just going to evolve into one team, and it won't be, just this and just that and just this. It's just going to be one collaborative team healthcare team for these patients.
Mm-hmm. Okay, so more individualized and a more collaborative approach to patient care.
Mm-hmm.
Would you choose the same career path again? It seems like you're pretty happy with it. And do you have any regrets or things you'd change?
Yes, so absolutely. I would pick it again, 100%. Love my career path. I would have done it sooner. Mm-hmm. I didn't have the means. I've been on my own since I was 17 and a half, almost 18. Mm-hmm. And so I didn't live with my parents, had a little bit of harder time getting through school. I probably just would have done it a little faster had I known what was going to be at the end of the rainbow when I got there. I would have done it a little sooner. But better late than never. And so here I am, and that would be my only regret, is just not going for it sooner and just kind of lollygagging for a little while and things that you do in your early 20s,
So, last question. What tips would you give us to become good healthcare providers?
Empathy. Just try to put yourself in your patient's shoes. Treat them like they were a family member. What would you do for your own mom? What would you do for your own brother or your own sister or something like that? Try to see it from their point of view. Don't be judgmental. That's another thing that we love to do. Oh, well, you should take your medications. Why aren't you doing this? You can be very judgmental at times. You can ask them questions. Why aren't we getting to the goal that we want it to be at? Ask them questions. What are their barriers? Make it a team. So not only is it the healthcare team, they're part of this team also. Talk to them, learn their families, their pets' names, just learn everything you can about them. And you'll actually get as much from them as they get from you, emotionally, professionally. And I feel like you'll love your career more if you do that.
Well, thank you, Dr. Corning, for being part of this interview.
Thank you.
Thank you again. And thank you guys for watching. If you have any questions, you can leave it down below in the comment section, and I can ask Dr. Corning for you and get back to you. And let me know who you'd like me to interview next. Thank you guys again for watching, and have a great rest of your day.
Thank you.